When you walk into a hospital, you see the obvious things, right? The doctors, the nurses, all the high-tech equipment. But what you don't see is this powerful, invisible system working 24/7 to keep every single person safe. So in this explainer, we're going to pull back that curtain and explore the incredible science of hospital infection control.
Make no mistake, every hospital is a battlefield. And the fight isn't just against the diseases that bring people in. It's against these microscopic invaders. We're talking bacteria, viruses, and fungi. These unseen threats are literally everywhere, and the entire mission of an infection control program is to build this impenetrable shield against them.
So you might be asking, how exactly do they build this shield? Well, like any strong fortress, it all starts with a rock-solid foundation. Let's take a look at the core structure that keeps a hospital's defenses tough and always ready.
At its heart, an infection control program is basically the hospital's official game plan. And it's not just one department tucked away in a corner. Nope, it's a massive, hospital-wide system that combines constant monitoring, really clear rules, and nonstop training to protect everyone under that roof.
A really successful program stands on 4 essential pillars. First up, you need a strong surveillance system. You got to be able to spot infection trends early. Second, you have policies specifically designed to lower risk. Third, there's continuous education to keep every single staff member on their toes. And maybe the most important part, all of this is grounded in hard science and epidemiology, so you know the strategies actually work.
Now this is where the human element comes in, and it's so important. I mean, you can write the best safety rules in the world, but they're just words on paper if they don't work in the real world. That's why the most effective programs are built by collaborating with frontline clinicians, the doctors and nurses who have to use these rules in chaotic, high-pressure situations. Their input is what makes it all work.
Okay, so once that foundation is solid, we get into the playbook. A modern infection control program has a whole playbook of advanced strategies. Think of them as specialized tactics that all work together to create these multiple layers of defense.
One of the most critical plays in that book is something called antibiotic stewardship. It really just means being smart and careful about how antibiotics are used in the hospital. By doing audits and giving feedback, the program makes sure these incredibly powerful drugs are used rationally, and that is our single best weapon against the growing threat of superbugs. And this is a perfect example of the power of information. The infection control team works hand in glove with the microbiology lab. By sharing data on which bacteria are causing problems and which drugs can beat them, they give doctors the intel they need to pick the right antibiotic the first time. It's just brilliant.
And of course, here's something that's so easy to forget, right? You can't have safe patients if you don't have safe staff. So a huge part of the program is working with occupational health. We're talking about things like vaccination programs and what to do if a staff member gets exposed to something nasty. You have to protect the caregivers so they can protect you.
Okay, so we have all these moving parts, all these strategies. Who's in charge of the whole operation? Well, let's step inside the command center, the Infection Control Committee. This is the central brain that guides the hospital's entire defense strategy. This committee wears a lot of different hats. It acts as an advisor, looking at the data and recommending ways to get better. It's a decision maker, giving the final stamp of approval on official policies. It also has a huge educational role, making sure everyone knows the latest info. And finally, it serves as the go-to expert for anyone in the hospital with a question about safety. And this is the crucial part. This is what gives the whole system its teeth. When this committee approves a policy, it is not a friendly suggestion. It becomes a mandatory rule for the entire hospital. That authority is what guarantees that every department, every doctor, every nurse is following the exact same high standard of safety.
And please, don't picture some small, stuffy group in a back office. No way. This committee is a multidisciplinary team. It has people from all over the hospital: doctors, nurses, pharmacists, lab techs, administrators. That diversity is their superpower because it lets them see the big picture and build a real hospital-wide culture of safety.
All right, theory is great, but let's make this real. Let's zoom in on one of the most high-stakes, intense places in any hospital, the operating room. This is where patients are often at their most vulnerable. Surgery, it's a modern miracle, right? It's our chance to repair the human body, to save lives. But the very act of making an incision, well, it's like opening a door for those tiny enemies we talked about earlier. Managing that risk is one of the most important jobs infection control has.
So the team has to think about risk from 2 different angles.
On one side, you have patient-related stuff, things like being older, having diabetes, or a weakened immune system that can just make a person more likely to get an infection. And on the other side, you've got procedure risks, like how long the surgery is, whether drains or implants are used, even the surgeon's own technique. They have to account for all of it.
So you hear all that, and it sounds pretty risky, doesn't it? But here's the good news. We absolutely know how to fight back. And prevention often comes down to some surprisingly simple, science-backed steps that have a massive impact.
Okay, first let's talk about some common traps. Things that seem small but can have huge consequences. Shaving the surgical area the night before, for example, can create tiny little nicks in the skin where bacteria can start to grow. Giving antibiotics too early or too late makes them less effective. And reusing things like instruments or antiseptic containers, that's just an easy way to spread contamination.
Now, let's just flip that on its head. For every one of those mistakes, there's a proven, science-backed best practice. So, you either avoid shaving or do it right before surgery. You follow strict, single-dose antibiotic guidelines, and you use individually packed, sterile instruments and clean, small-batch antiseptics every single time. It's a clear solution for a clear problem.
But look, these best practices, they don't just magically happen. They're built on a system that absolutely depends on teamwork, on constant education, and on crystal clear communication. When everyone, from the surgeon to the tech to the pharmacist, is on the exact same page, safety just becomes second nature.
And really, when you boil it all down, it comes to this powerful idea. Safety isn't just one department's job, it's a shared responsibility. And when everyone in that building takes part, it doesn't just prevent infections, it elevates the quality of care for everybody.
So the next time you think about a hospital, I want you to remember that invisible shield, built by science, teamwork, and a whole lot of dedication. Infection control really is everyone's job. So what's one thing you've learned today that really changes how you see safety inside a hospital's walls? Thanks for watching.